That's okay. Thank you. All right. Okay, so Colleen went through the whole CPQ in the last session and everybody was riveted. And so now we're going to go through the different items and I'm going to share my screen and you're going to see not the most recent version of side-by-side CPQ, but the one before COVID. And we'll go through and I'll make a little bit of comments about some of the items and the items that we changed or added to capture what we do in brain injury clubhouses. And please ask questions as we go. It'll help if we don't save the questions till the end. And then when we get through these items, if Dan comes back, it sounds like looks like he might have just gone to deal with an emergency the way he ran out. He's going to show you a spreadsheet that they developed at Beechwood when they started doing the CPQ for that research project that we did. A lot of us use electronic health record systems, and so we pull reports from that to get some of this data. But if you don't have that, the spreadsheet might be really helpful. All right, let me see if I can get this up. There. Are you seeing my CPQ? Okay, let me pull it over here so that I'm looking at it with the camera. Okay. Hopefully I'm not going to cough the whole time. So there's not much to say about this first screen, the profile screen. Colleen already talked about that. So I did go to Clubhouse International training a long time ago, as you can see. And so yours probably won't have anything in there, but mine has the first training that I did. And so this next screen, this is where we start to get into some questions. And I want to start off with this first question: how did your clubhouse start? Now, these options are mostly there for mental health clubhouses, but you see where we have rehabilitation facility there. So places like Brooks Clubhouse that was started by Brooks Rehab, that's what you would choose there. If it's something like Beechwood is started by another disability, a larger disability service organization. So you might choose other and then just type that in.
Cindy,
Yeah.
I'm still seeing your profile screen.
Okay, hang on. Let me stop sharing.
If it doesn't change any automatically, you might have to do stop share and do a new share on your screen.
Again. Thanks for telling me that. Okay, you seeing it now?
Yes.
Okay, thanks. All right, so let me show you this little drop down again real quick. So Brooks would have chosen rehab facility and Beechwood would have chosen other probably. Now, here in the location, you know, some of our clubhouses do share a building with others. So you would want to indicate that here. And then over here, this is your geographic area. If you're in a big city or a small town, you would choose what the population is in the area. I just changed this the other day when I pulled this up. I had just estimated it before, but you can actually Google unemployment rate for your state and it'll give it to you just like that. And so you just type that in there. And then the operating budget goes here. And we're a standalone, and so we don't have indirect costs. But for most of you who are part of an hospice agency, you probably will have indirect costs. So this can be, you know, like what the hospice agency charges for your overhead to them. Okay, so, and stop me at any time. And if somebody else could monitor the chat, that would
Cindy,
help.
do you want me to talk about my questions that I've had when I was going through this as we go, do you think?
Yeah, as long as we don't get bogged down in it, because there are some pages that we really will need to spend a lot of time on.
Okay.
So have we hit one yet?
Well, the indirect cost piece, we have budgets that are separated budgets for both of our clubhouses, even though we have an auspice agency, because there's a percentage of the full budget that each of us. So I know this is a question we always have regarding the budget of what would put direct cost and what to put in indirect. If you do have a separated budget, I mean, I guess I just don't, sometimes we still have a conversation about that every time when we're doing it of what goes where.
You know, Colleen, you can weigh in here. My philosophy is don't sweat it. Just, you know, just be consistent from time to time. But
yeah, Cindy, can you click on that direct cost in blue though?
Yep.
So there are definitions there. So like that's going to be your salaries and things like that. Your indirect might be the rent, you know, if you're paying rent or, you know, a copier to rent a copy machine or the phone bill, those would be your indirect costs.
Well, shouldn't every clubhouse have both direct and indirect costs then?
Typically, I would think so, but we also, like I mentioned in the last session, some of the employment things are hard for clubhouses to do. Some of the budget things can be hard for clubhouses to do too. If you can't separate out the direct and indirect, it's not the end of the world. Just having the annual budget is helpful.
Yeah, and some clubhouses, their auspice agency did not separate that out. And then when we got their budget, it was so super low that we knew that they hadn't included that.
Okay, that makes sense.
Okay, so when we get down to the funding sources, we added a few here for the brain injury clubhouses, like workers' comp insurance, which actually is a private source, but it's over here under government sources. That is new for us. And then one question that comes up is about where to put the state funding. If it's a grant, it would go here in national state grants. But if you're just getting straight out funding from the state or your local area, it would go here in state or provincial. And then public insurance programs mostly is Medicaid. So this is like our funding through the Medicaid waiver. And then private insurance, you probably won't have much of that. We used to have somebody who was funded through the no fault insurance in Michigan. And so that was that amount. And then with the fundraising, that's divided into two different sections here. And so this is your grant funding, like when you write grants to private foundations. And then everything else, events, private donations, corporate donations, that goes here, donations and other private sources. And then for private pay, these are the people who, for us, who are paying on a sliding scale. See, that only makes up 8% of our budget, the whole private pay. Any questions about that? And then it's important here, and this is a question that you're asked in your CARF survey too. If you receive private payments, these private pay, do you have a sliding scale?
Cindy.
Yeah.
The area where it says income generating activity, is that where you would put things like Giving Tuesdays or some of the things I've heard about clubhouses?
No, that would be still, that's a great question. That would be still in donations because that's fundraising, that's charitable revenue. This would be like, we have a clubhouse who rents out part of their space.
Okay.
And generates activity that way. I mean, generates revenue that way. Okay. So moving on to managed care, we would all be no for this. This is usually a Medicaid managed care system. unless your state has started including what they call ABD, aged, blind, and disabled people in their managed care system, and you're receiving funding through a Medicaid waiver, more than likely your answer is no here. And so we added these blue questions here under the Medicaid funding. I don't know why this is new. This is from an older survey, but yes, we are funded through home and community-based services. And then we write down, and this will help us later. This helps other groups as they are applying for funding in their states and doing advocacy to try to get Medicaid waivers. Is I get questions a lot from different groups. What are you reimbursed for in your state? And so I know like Beechwood gets reimbursed for all different kinds of services. We only get reimbursed for adult day services in Georgia. So that's what you would put there. Okay, so this is the hardest screen to me, and I'm going to let Colleen talk about this. I understand the total membership to be everybody that you've served forever. Like we're up to over 700 now, even though this says 554, it's a couple of years old now. And so cumulatively across the life of the clubhouse, how many people have you've served? Now we had a program in the study that had not been counting this along the way. And so Colleen encouraged them just to estimate how many people they've served. But it's a really good reminder to keep track of that, because this is really powerful as you go for funding to say, this is how many people that we've helped. We even, this is a little side note, we even started collecting now in our electronic health record system, how many people we impact. So like if we make a presentation and we impacted 75 people, we would put that. And that's a really good thing to brag about when you're doing your annual report and talking to funders. So as far as total active members a month, we always get the question about which month. And Colleen has in here for during the most recent 30-day period. Now, we have said in the past sometimes that it's a recent 30-day period that you choose that's representative of your normal program. Now that's going to be a little odd here during COVID, but Colleen, what would you advise us to use now when we do this next CPQ for the recent 30-day period?
I mean, I would still try to do a recent one. I know people have emailed about questions about, because some of you may be still be doing some virtual services in addition to face-to-face. I would still count the people that you are doing virtual supports with, assuming they're engaged. So whether it's a staff kind of meeting with them, if they're participating in a work unit meeting or something in the work order day, then I would count them as active. If it's somebody who hasn't been in at all and you're just calling and checking in with them during the pandemic, but they're not involved with any of the other clubhouse activities, I would count them in outreach, but not in the active membership. Like if they're not participating in anything virtually, you're just, sending them a note or an email or something like that, then just count them in the outreach. And that definition is a little different right now because of the pandemic. So here you're going to have virtual too, most likely.
Right. And later on, there's a question about reach out. Do you do reach out? And so there's a little bit of confusion about whether outreach is the same as reach out. And we have included, although the number that it doesn't show here, we've included people who we call to check on in this. So then the total active members, this is for a quarter, for a 3-month period. And the thing to know is that the 30-day and the 90-day number that you put here is going to pop up on other screens. And it's going to force you then to have things add up to that number. So you want to be careful with this number. So you would count people who've come to the social programs, people you're coaching on employment sites, and people who've come into the clubhouse, and people you're providing services to virtually. And again, not the reach out, but the they're actually engaged. Okay, so these other two questions, these next two are a little bit confusing too. The average daily attendance is, so you're gonna count how many people you've seen, and this goes into TE. But if they're employed in the community, but they didn't come into the clubhouse, or you didn't go and coach them or anything, then they get counted. And then you want to total those up for the month and then divide it by the number of days that you provided services. And that's your average daily attendance. And then your work order day program attendance, you might be subtracting some of those people out if you had people who were attending just the social program or just getting coached on the work site and were not receiving services inside the clubhouse. So for us, that's usually the same number of people because nobody's, counted more than once. Okay, questions about that? Or Jessica, anything you want to weigh in about that?
Well, I do think for us, that would be two different numbers, only because we do have some members who will come for social programs and may only come virtually still. So I feel like that's a place, even in COVID, might be a little bit different because it's very hard for us to integrate members into the work order day virtually. There are some members who do some tasks from home, but in this environment, I actually think it's going to be more different than normal for us.
And that's really cool because we'll be able to capture that.
Cindy?
Yes.
Would you mind explaining average work order day program attendance one more time?
So this is the people who actually come into the clubhouse.
But
If you're only doing virtual services and you're having like work unit tasks virtually, you would count them now during COVID perhaps. But if they're just checking in or doing the social things that you have, but they're not doing the work, they're not receiving the services, then you wouldn't count them.
Okay. And you said people that we made job coach or out in the community, that would go in the average daily attendance?
Correct. Okay. Unless they also come into the clubhouse that day.
Right. Yeah. So say you go visit somebody at work, they work from 9 to noon, you go visit them at work and then they come to the clubhouse after, you want to make sure you're only counting them once. So you wouldn't want to count that person twice because you saw them in the community and at the clubhouse for that day. So that's kind of the main thing there, is just making sure you're not kind of duplicating people. But certainly if somebody's participating in the work order day virtually, you could certainly include them in that average work order day attendance right now. And we know things are a little different because of the pandemic.
Yeah, and I would say that for now, because things are so different, just keep some notes, about how you decided who to count. So if we come back and have questions, if your numbers are way out of whack from what other people are reporting, then we can see how people are collecting that.
I wholeheartedly agree with that. Keep all of the sheets used to count, because you will question yourself when you look at the numbers the next year and be like, how the heck did I come up with this? So I'm just saying, every worksheet that I keep it now. Yeah.
So this, the last question in that square, the members participating in evening or weekend programs, some of the clubhouses I know don't have evening and weekend programs. So you wouldn't count anybody in there. But if you are doing, like we do a game night, we do social Saturdays, things like that, that's where you're going to capture the number of people. And this is social activities outside of the work order day. Okay, so the intake is pretty self-explanatory. And then this next couple of questions brings up a few questions from people. So how many people who tour the clubhouse become members? That's people who actually come on site and you show them around. This next question, how many people who participate in orientation become members? Some clubhouses have an orientation period, and it's like a trial period where they decide if it's a good fit or not, or you decide if it's a good fit. We don't have that. So our percentage is 100%. If you come, if you tour and you decide to come, then you're a member. I would say if you have people who come and they come like one day or something and they're like, oh no, this is not for me, then that's where you would capture that. So does a clubhouse guarantee lifetime membership to members? Yes or no? You know, that's a standard, but sometimes you have clubhouses who, you know, say, well, our funding now only lets us serve people with traumatic brain injury instead of other acquired brain injuries. And so we had to tell them they can't come. That's where you would count that. Do you have written contracts or verbal agreements? Hopefully not, but sometimes, again, you'll have, you know, a Department of Justice referral or something like that saying you have to participate. If we have something like that, we count it as no because the clubhouse doesn't have the contract. They have it with some outside agency, whether or not they come and participate. All right, and then the other questions are pretty explanatory until we get down to, this is one that we added for brain injury clubhouses, is does the clubhouse accept members needing one-on-one personal support for ADLs? And most of us do, but most of us, hopefully, we don't provide that assistance from our staff because then we become, you know, more of an adult daycare center. And then that's what the staff is doing rather than working side by side with members to do the work of the day. So the next question is, do you provide that assistance? And then how many of your members actually bring an assistant with them? Because a lot of us have that kind of requirement that you can need assistance, you just need to bring that with you. So we're just trying to capture that so that we, not to say you should or you shouldn't, but so that we can tell, you'll see later where that would start to have an impact on other services. All right, let me move on because we're running out of time here and we got a lot of sections, but the rest of them are not going to take as much time, I promise. That was the heavy one. All right, so this is referral sources, and of course we changed this because our referrals come from different places. So if this BIA affiliate would be your state brain injury association that might refer to you. And we get a lot of referrals from external case managers and claims adjusters. And then you've got Voc Rehab that a lot of you guys get your referrals from. And the rest of it, I think, is pretty self-explanatory. Ask me if you have any questions about that. All right, so then if are people with diagnosis in addition to brain injury eligible for membership? I don't know how that ended up being like that. Yes or no, but this question used to say, do you accept people with other diagnoses than brain injury? And that's why the answer was no, but we changed it to say in addition to. So we all require that people have a brain injury, but do we also accept people if they have a mental health diagnosis, ID or DD, or a substance abuse diagnosis? And then so we separated that out to, are people without a brain injury eligible for membership? Probably not, but there's a clubhouse in California that is designed to serve people with all kinds of cognitive disabilities. And so they would say yes here, and they would probably have a good number of people here with intellectual disability. All right, questions on that? All right, so this next section is where you start to see everything has to add up to what you put in for the 90 days. So this is just capturing ethnic information and then age. And then the diagnosis is the other section that we changed for brain injury to look at traumatic and non-traumatic brain injury. So that would be everything else like stroke, anoxia, infection, tumor, all of that would go in the non-traumatic brain injury. And then over here on the right side is pretty much the cause of those injuries. So these are just kind of the top choices. And we end up getting a lot of others in this pie graph when we add it up. But this would have taken a whole screen if we went through every diagnosis, every cause of injury that we all serve. So we tried to get violence and crashes, falls, and stroke. And stroke would be any kind of cerebrovascular accident. So aneurysm, thrombotic, embolic stroke, those kind of things. All right, and then this is also really important and helped us a lot with the research, because we learned that we are serving primarily people who've been injured for a very long time and had very severe injuries. So please try to, and you can estimate this if you don't capture this data. Don't worry about going back and interviewing every single person that you've served, but it is a good thing to begin to capture if you're not already capturing it, which is a little hard when you have people who've had more than one injury. All right, so the staff, I don't think we really need to spend much time on this. I will say that it's a little confusing for me about the full-time and part-time staff, because we have several staff like myself that are starting to become more part-time. And so a lot of these are numbers from a couple of years ago before that started happening. And because some other questions refer just to the full-time staff. So the full and part-time staff that are unit-based in the smaller clubhouses, like I know Jessica, sometimes I've emailed her and she said, I'm sorry, we're short-staffed. I'm working a unit and I can't get back to you for another month until I hire somebody. And so I personally would count her as somebody who's unit-based that year. I just count volunteers and students who are working in the work order day, not people who come to work for like fundraising events and things like that, but people who are actually working with the members. And then this was a question that came up earlier today. We generally don't have many of these folks. Sometimes we have had a staff member who was a consumer of brain injury services, but wasn't a clubhouse member. And so I did capture him when he was working here. So then this is just the, the education levels of the staff. We talked about that this morning, so I won't belabor that. The length of time they've all been working there, the salary ranges, I won't belabor that. And then when we get to this is when these next few screens is when it really starts to get interesting to me as I look to see how our clubhouses are designed. So this is where you want to talk about what kinds of meetings you have at the clubhouse and in which subjects. And if you don't have formal meetings, then just say you don't do it. Don't try to say, oh, well, sometimes we do it, but it's more informal. If it's a meeting about this topic, then say it. And if it's not, it's fine. This is not a you should or you shouldn't kind of thing. It's just a survey to see what all we're doing. And then with the interior space, like Colleen said, this is really helpful for new groups. They always want to know how much space should we start with. The accessible space to members. Of course, we want everything to be accessible to members, and that's part of the standards. But honestly, you know, we have to keep some things locked up. And so we don't have everybody have access to everything. All right, now, this is really where the rubber meets the road. So this is the hours of your work order day, not the hours that the building is open, but when is, and here's a little definition of it. When is the actual work being done? So that you put in the time here, how many work units you have, and then look at this definition. By distinct work unit, we mean a unit that has a title, a unit leader, and a specific location in the clubhouse. So for those of you who were saying, well, we added 4 more units and we have advocacy unit one day and we have wellness unit one day and fundraising unit one day, that's not a work unit. You're calling it that, but we want to know how many specific locations of the unit that you have. We'll pick up in other places all the other types of work that's done in that unit. Now, if you are really calling it a work unit, then go ahead and put it there. That's good information to have. But generally, that's not what a work unit typically is. And I thought Ruth did a nice job this morning talking about how that has evolved in the history of Clubhouse International, how it used to be like that. And now they're encouraging fewer work units and just dividing up putting different, categories of work within the unit. So these are different types of activities that are done generally to keep a clubhouse running. And so you're just going to check off whatever you do in the units, not, the fact that you provide supported education outside of the work unit, but is it done in the unit? You would check it off. And then here, you're going to name your units, how many hours it runs. And this is where we would pick up if you're starting to have units that have like 1 hour a week and they have 3 people in it. So that's pretty self-explanatory. And then here's a good place just to start listing what all you do. And this will just be really good as we go along and compare clubhouse to clubhouse.
Cindy,
again, yeah.
Give an example of supported education, what you would consider that for this particular profile.
Supported education, in general, in a mental health clubhouse, it would be like GED tutoring, helping people, do online college courses, things like that.
So not like keyboarding, increasing your computer skills within the clubhouse, things like that.
No, I wouldn't consider that supported education myself.
Okay. Just want to make sure.
All right. Now, employment, just a couple of things to mention about this. Colleen went over all these sections in the last session, but we added these sections on the end here for brain injury because we do often go into the community with people to volunteer for, you oftentimes kind of legal reasons that they're not able to work yet or for practice. And then this is customized supported employment, which is used commonly here in Georgia. It's used with people with brain injuries, or we use it, I guess. But also it's used with people with developmental disabilities where it's often, and Colleen has a really nice definition here, it's often self-employment, and it's what you might have heard as a carved out job. So often people don't go on interviews. You might not work for a traditional employer. You might be self-employed, or somebody's like paying you to, walk their dog, and you've got your support person with you doing that. That would be this with support. And then the CSC without support means that the person does it without any kind of support, you know, that they're totally independent with it. And then if you do something different, you can certainly describe it here. And so this just captures who's paying the member. And then our philosophy for employment services. Now, you guys, a lot of you guys who are not doing employment work, you might not have a policy, and this is a drop down of these to pick your primary one, or you might just do readiness assessments and then job placement, but you might not be doing the job placement. That's okay. Just put what your typical, pattern is. And then down here for the cultural or local influences, I put things like, we have a lot of workers' comp clients who are undocumented immigrants, and we're not allowed to get them to work. And so I put that there.
Cindy,
right.
before you go
Yeah.
on, Cindy, because you're starting to get into tabs that not everybody does everything. So could I just present the spreadsheet and just quickly run through? Because
Sure.
what mine does apply to everybody.
Sure.
Yeah.
Because
So,
we are starting to run out of time.
yeah, we
do
only
that.
have, okay. Can you turn over the screen so I can share my screen?
And,
Thank
you know,
you.
I would just say while you guys are doing that, that if people have questions about what to enter or how to interpret an item, you can email myself or Cindy at any point in time, and we'll help you figure it out.
Okay, can you guys see my screen?
Yes.
The spreadsheet? Okay, so let's see. All right. I put the spreadsheet and my PowerPoint slide. I only have like 5 slides, but this is to help you collect your data and track it from year to year. So you can download that from the conference Google Drive. So I'm going to go real quick because, and if you have questions on using the spreadsheet and all of that, you can always contact me for assistance. But to keep yourself organized, I would create yourself and I'd pick a CPQ network folder, and then have your data in subfolders by year. And then I personally wish I had done this. I did not do this first step, but I have started taking screenshots of every tab that Cindy was showing you earlier. I take a screenshot and I snap it and save it in that folder as well. There was one year where there was a problem with my Access database and I had to reconstruct it. Thankfully, I had saved the data beforehand, the screenshots, and I was able to re-enter that. It was a glitch on our side and not on the other side of things. Now, I think Colleen showed us how we can repopulate that. I don't think were we able to do that the first year? I don't think so.
If you hadn't entered anything yet, you wouldn't be able to repopulate. Right. We also have once you send us a data file, I actually have the capacity to load your data into a blank instrument too. Yeah. So
we had run into trouble our first year, so we had to repopulate it. So just at least for the first year, you want to take screenshots before you start, and then after you end. I suggest you do it before you start and then print them out, because depending on how big or small your clubhouse is, you may have to get information from other parts of your organization. So having those screenshots printed out, it helped me to show people in different departments at our place where the type of information we were looking for. The other thing you want to do is after you print out your shots, you might want to take notes as to where you're going to be gathering the data from each tab. So you'll just want to write down some notes like where you're going to be getting some of these things and who you might have to contact within your organization to get that data. So for example, our referrals sources, we've gone through some restructuring at Beechwood, but prior to this past 2 years, we used to have an admissions person right here at Beechwood, and we were able to get the referral data from her. And now that we're restructuring, I'm now going to be required to track that referral data ourselves. You also want to set up, this is the spreadsheet, the member data spreadsheet, and I will show you this. So what I have done is created, and again, I put some fictitious names in here so you can actually save this and then use it yourself and then fill it in with real member names. But you're going to want to put the last and first name if you have any kind of organizational ID number. We have an electronic healthcare record at Beechwood, so we put in that organizational ID number in our spreadsheet. And then for each of the things that excuse me, that Cindy was going through earlier, we keep track of that. We keep track of referral sources, funding sources. I populated the referral sources now, and these are just simply pull down menus. So all of the categories that are in the CPQ database, you would then be able to identify which one belongs to each member of your clubhouse. We keep track of a clubhouse admission date. We do have discharges. I know that we're not supposed to discharge everybody or anybody from clubhouse, but there are particular things that do happen. And then I have a separate discharge sheet. For example, people die, people move away. We've had a situation where one member was physically abusive towards another, and we just couldn't have them participate anymore because they were creating too much of a dangerous environment. So there's very few conditions where you would discharge, but we do have that gender categories, female, male, transgender, and other, the date of injury for each person. And then it wants you to know the length of time. You're supposed to categorize your members according to those who are less than a year from an injury, those who are 1 to 5, 6 to 10. And if you put in your date of injury, and then you'll be asked to pick a date from which you're going to use your 90-day total. You put that date in. So last year we did it August 31st, 2020. I think the CPQ is due October 31st this year, correct, Cindy? So if you do the 90 days prior to October 31st, you would put the 10/31 date in here. And then this column has formulas in it that will automatically give you the number of years, months, and days and then what I do is I just go in and I color code the different categories. There's all of the date with respect to the age group. Again, if you, for the age category, you put the person's age will be calculated based on their date of birth, and that date the study for calculating time of injury and the age. So it pulls from this column as well. And then with keeping track of different types of comorbidities and dependencies, we have whether a person is nicotine dependent, whether they are marijuana dependent, opioid dependent. These are all categories that you're going to want to keep track of for the CPQ. Type of injury. Again, the categories that are in the CPQ we have here from pull down lists. And then if someone has a specific comorbid diagnosis, we put that in. And then the other thing we do for comorbidity is, so for example, someone who might get admitted with bipolar, who also has a non-traumatic brain injury, but later they may have a comorbidity of mental health and substance abuse. So we actually, these are the comorbidities that are listed in the CPQ, and we have them listed. Now, all of this stuff is programmed, and I don't know how knowledgeable you guys are with Excel, but I can help teach you if you're not familiar. But all of these, beyond this black line, that's where the data is for these pull downs. And if you have extra referral sources, so like I put the referral sources that are listed in the CPQ, but your state may have a different funding source, as Cindy was saying earlier. So you can add referral categories to this, but you're going to need to figure out which ones they fit into based on the CPQ's categories. So what I've done is just kind of stuck to what's on the CPQ for each of the categories and stuck to the choices that the CPQ is asking you to identify. Does anybody have any questions? That's like a real fast overview.
That's great, Dan.
Do you still hand count in the categories, or do you have a count if where it does all the auto population of all the counts?
I'm sorry, what's that?
Does it auto count for you? You need a count if.
It does not auto count. That's one of the things that, I mean, you could do formulas, but it would become very complicated for it to count. So I just go through each of the categories later and I just count by number.
Mhm.
It doesn't take that long once you have the data here.
Yeah,
I
I
mean-
mean, getting the data together is like all the battle for
Right,
sure.
right.
Yeah,
So
I have a very similar spreadsheet, but yours is more sophisticated, Dan. I'm gonna steal yours.
you can program it to do the counting, but it becomes very difficult if you want to make any changes. For example, I've locked these cells that were over here on the right-hand side. I've locked these cells so that you can't delete any rows in these first 10, 11 rows, because you don't want your data from which all of these other pull downs are programmed from. You don't want to lose that. So if you were to delete a whole row and you lost the ability to have a VA as a funding source or other clubhouse members, I mean, you would lose all that data across, and then you would lose those options from your pull downs here. So
Hopefully some of you like us have a electronic health record system that'll collect some of this for you. If you don't, by all means, use this.
are you able to pull this from your EHR, Cindy?
Oh, yeah,
Yeah, we don't have the ability to do that.
because we customized it.
Oh, okay.
Yeah. So before we end, and we can go back and talk about this spreadsheet and other tips. Something that we forgot to mention earlier that Dan just did is if you already have done a CPQ, then your clubhouse has it and you can begin to fill it out at any time. We're going to ask that it's due at the end of October. And we wanted to wait to have this training before we sent blank ones to everybody. So there is a little bit of a shorter turnaround. If you have difficulty with it, just let Colleen and me know, and we'll give you a little extra time. But she should be sending out blank CPQs to the new clubhouses that haven't gotten them within the next month. Or not within the next month, but within this month, you should get one so that you have a month to complete it.
The one last thing that I wanted to bring up was that you were mentioning taking notes. So every year we have a special note file. We do it in Word, and then it just explains how we get to certain things, or if we've had difficulty in a particular year, and how we came to the conclusion of which members, the number of members we had in each work unit that year. If there's a special note, like with respect to like our employment tab, because we here at Beechwood, we don't have, we have two separate departments. We have a supported employment department and the clubhouse. we make we distinguish between when someone's doing stuff for support employment. If we assist them through the clubhouse with the support employment staff, then we might count that time in clubhouse, but officially we don't do supported employment within the clubhouse. So you might want to just have special notes for yourself. We keep track. There's a question about like how many members are earning and what do they earn. So we do keep track of that, and we'll make notes of that. How did we come to like moderate, severe? Well, you know, some of this will even support what's in the Excel spreadsheet. So it's important to keep track of your notes, and those are just some examples.
That's great.
And I would just add to that. So your situation, Dan, is not unique for the brain injury clubhouses, where you might have a separate provider or contractor that's doing the employment supports, which we don't ever see in the mental health clubhouses. They do them directly.
Right.
But your situation's a little unique. So if that's the case, it is good to have some notes later. So if I go back and say, gee, you have no employment at all or nobody working, it might be because of that's the way it's structured in your clubhouse. So it is good to know that it's not that members aren't working, it's just the way your services are structured. Somebody else is providing those employment supports.
And this is like a screenshot of, you know, the work order day tab. So these are the kinds of things like we can pull this data up if something happens, although that's just your first year. You don't need to do that after the first year. Once Colleen has your data, she can repopulate that for you.
But boy, just think how helpful this is if you left, Dan, and somebody else came in to do this. Man, I would just love having those screenshots too, just to see, you know, from the very beginning, here's how they decided it in the very beginning.
And I just save,
really
I save each screenshot according to the name of the tab. As you can see here, I don't know if that's too small for you.
Yeah, we can see it. I can see it.
Okay, all right. Now how do I unshare my screen? Here we go. Here we go. You can take over now, Cindy.
Well, I think we're here. Sorry, we have 3 minutes for more questions, but if you have any other questions, otherwise there are just a couple of other highlights I wanted to hit from the CPQ. I won't even share it again. I
don't think our annual meeting is until 3:30. Can we keep on for a little while?
Yeah, it's fine with me.
Do people want to stay on?
You guys are.
There's just a break from 3 to 3:30.
So if you want to stay on and learn more about the CPQ, I think it's pretty important.
No response. But let me just hit.
I think we might need a quick little break.
Yeah, let me just take 5 minutes and just hit a couple of important highlights here. This functions of the house is really important, and we did add some things here for brain injury. Most of us are just providing services versus the members providing the services, which is fine, but please go through this and indicate whatever you are doing. We also have in here, let's see, what tab is it on? The life, oh, here we go. Down at the bottom here, the life skills training, we get questions about that. Everybody does life skills training in a clubhouse, but this is to pick up if you're kind of providing that as a billable service. And if you're providing ongoing life skills coaching after that training is finished, if you're following people one-on-one in their homes and communities, not just when they come into the clubhouse, that you're helping them, you know, figure out how to get their medications filled, that kind of thing. So that I wanted to point out. And then with the transportation, we're going to make a little bit of a change to the CPQ to combine paratransit and local disability transportation. But in case when you get your CPQ, it's not combined. This is meant to capture like public transit that's paratransit. And then this is like the disability kind of transportation.
Is that Medicaid funded? Disability
usually, yeah.
Okay.
It's for us in Georgia, it is.
But they're becoming combined. Is that what you're saying?
Yeah, because like Medicaid in our state will use the public paratransit. They'll pay public paratransit to bring people if they're within the county served by that, and then they'll pay the private disability transportation companies if they're outside of that.
So
That's-
Cindy, when you say you're
ours
gonna
are
combine
separate.
them, are you gonna, will CPQ be combining the numbers for us when they, or is it something that we're gonna have to do manually?
You mean the paratransit and local disability
Yeah.
transportation? I don't know. Colleen?
She stepped away for a minute, she said.
Okay. All right. I don't know the answer to that, but let's not worry about it. too
Okay,
What was the
All right.
question?
The question is, we had talked about combining the paratransit and local disability transportation into one item. And Dan's question was, will, when that happens, will it automatically combine their numbers from the previous years? I would think no.
No. And that you could put it all in one. I mean, if you want to just use one or the other, that's fine. But because of the way, so when you send me your data, it actually, all your data files get merged into one bigger kind of master data set. And it's going to look for each one of those. So I can combine them together afterward, but to do it, you'd lose some of that. You'd lose one or the other if you were just to take one away completely. Historically, you'd lose a piece.
well, Cindy said that they're gonna be joining, they're gonna be combining the paratransit and the local disability transportation into one category next year. Is that
Yeah,
this
we-
year with October 31?
No, we won't change anything now, but Colleen, that's something we had talked about doing because people are picking one or the other, but we can just combine them together when you
Right.
aggregate the data.
That's
Okay.
what happens when I report it out. I merged those two.
Oh,
Okay.
okay.
All right.
y-
So real quickly, the social and rec programs, this is meant to capture the social programs outside of the work order day. And to capture how you're dealing with holidays, which we know we do it a little bit differently than the mental health clubhouses. And then for the funding and governance, this is the other, Colleen, I think this might be an old way to look, this might be appearing differently in the new version of the CPQ, but we want to capture which of the IBICA standards you're having trouble with and which of the Clubhouse International standards we have trouble with. Generally, we have trouble following the TE, the housing and formal education programs, and the meetings that where member issues and program issues are discussed. We changed our standard number 8 to say where those decisions are made, not just discussed, because we do tend to have staff meetings because we have to talk about safety issues. So, and then the other point I wanted to make is how you make decisions. This is important for a clubhouse, is if it is by democracy or by consensus, or some other way. And then if you have a parent organization, that's what auspice means. And you probably won't be able to catch it in these drop downs. So just put it here in other, if you have an auspice agency, just what type of agency is it? It's a brain injury service organization, it's a disability service organization, that kind of thing. And then finally, we really want to capture if you have a board of directors, if you're freestanding, of course you would because you're a nonprofit organization. If not, do you have an advisory board that so that we know if clubhouse interests are being represented at at an advisory or decision-making governance type level. That is probably the top ones that I hadn't already covered. That's it. Questions, comments? Are you excited?
Can I just mention one thing, Cindy, for the clubhouses that are
Yes.
in Virginia or who are using BI First, which I actually think Illinois is using it as well, that Claire is going to be bringing to the CCB. We have this whole change board to change anything in our system. However, there's a number of things that are within the CPQ that we think would be totally useful within our actual consumer profile in our system. So she's actually going to be bringing changes related to that as a request so that we can pull reports on things like we don't actually have a checkbox for intellectual disability or a checkbox for any kind of the substance abuse things. And so just FYI, if you are in Virginia and are trying to pull those reports and are ending up hand counting a lot of those, we're going to be working on that. So.
And Jessica, I would say if it's something new they're adding or customizing for you, feel free to reach out to me or have them reach out to me so that it's formatted the same way.
Okay.
If possible, that will save you guys a little bit of work. So if they're asking for something, it's kind of worded or measured the same way, so you're not then having to go back and remeasure if possible.
No, yeah, my hope was that we could pull and have drop downs that are exactly in relation to what's in the CPQ for a number of those things. There's some things we already have in our system and we can't do too much with because we have old data, but there's some things that just don't even exist. And I think we'll be able to put them in exactly as said in the CPQ.
See, that's where the spreadsheet, we have the same situation where we are, Jessica. That's why I created that spreadsheet and used it according to the categories that the CPQ does.
We just have this much ability to change ours. So hopefully we can make it happen where ours lines up a little bit. Because right now I'm doing a spreadsheet too. I mean, because we don't have that capability to pull those reports.
Right.
Yeah, we can change the CPQ too. It just costs a lot of money.
Yeah.
Well, that's exactly what it is in Virginia for our case management system too. So I know it has to, that's why it has to go before a board to get changed, but hopefully we'll get some of that in there.
Yeah, and so as we close, Colleen, what do you think the chances are that the CPQ will end up becoming web-based? How's that looking? I know Clubhouse International was looking for funds to try to help that happen, and can we piggyback on that?
Well, so I have it gets a little tricky because the short answer is yes, hopefully. The longer answer is it's a little tricky because, we're a university and, on our end of things, it's more research. So anything we put on the web ends up sitting on our web-based servers and has all like the IRB and research levels of security because of the data. It's not to say that we won't do it, but there are some nuances because of, who we are and how we house the data. So coming up with ways where you can access your data again, once you enter it, like you can in the CPQ at any point in time, because you actually have the tool in your clubhouse. We're trying to work through some of the things like that.
Mm-hmm.
But we are looking into it. If they can get it figured out for the mental health clubhouses, I'm sure, we could piggyback you guys onto that, because it's just mostly changing some field names. When I gave the existing access database to the team here that's looking at it, their question was, why are you changing this? It looks like you put a lot of thought into the access database, and it has a lot of nice features and functionality. But, I kind of explained to them why people might want a web base, and that, access isn't always the easiest thing for some people to get and install. So yes, so long term, probably at some point, but there are just kind of those nuances and wrinkles that we have to work through
Okay.
before we
Good to
do
know.
that. But we are kind of feeling it out.
Cool. All right. I think we're done, y'all. It's exciting. Thank you all for hanging in to the very end, and 3 hours of research and CPQ over 2 days. We've waited 20 years to do this, and here we are. So I can retire in peace now.
So, and
Carry
just
on.
so everyone knows, I know we did mention it yesterday, but we did submit an article for publication with CPQ data from the research project. So it's actually been reviewed once and is now being reviewed, that we've made some revisions based on the reviewers' comments. So hopefully within the year, we'll have some of that data out in print in a peer-reviewed journal too.
Yeah, it'll be awesome. And that's to brain, right?
The brain injury, yes.
Brain injury. Okay. All right, cool. See you guys in a few minutes. Joe, more power to you.
Woohoo.
Take care, everyone.
Bye.
Thanks, Colleen.